Hi, my name is Sarah Heldman. I'm an occupational therapy assistant and assistive technology professional at the Wood County Board of Developmental Disabilities. I'm recording this presentation today on February 5th, 2026, and it's important to note the date because we know that assistive technology is ever changing. So I'm sharing resources that we know exist as of today. So we're going to be talking about assistive technology for health management, and we're going to specifically focus in on medication management because this is an area that we work with quite a bit. So our objectives today are that you'll be able to identify why assistive technology matters for health management, that you'll be able to list at least 3 factors to consider for person-centered planning, and that you'll name at least 3 assistive technology solutions to address health management. So before we really dive in, let's make sure that we're all on the same page about what assistive technology is. So assistive technology is an item, piece of equipment, or product system that can help you increase or maintain your independence, skills, and involvement in the community. And I really love this quote. It's a little bit old from 2006, but I do still like it and I think it's relevant. So Kathy Snow says, to be successful at home, school, work, and in other environments, to achieve our hopes and dreams, and to simply get through each day, everyone needs assistive technology, accommodations, and support. I certainly know that that's true in my own life. At work, using things like my Outlook calendar, a notes app to keep track of things, our documentation system. Sometimes I'll use speech to text to write my notes. So I'm always using assistive technology to help me get through my day. So, some reasons that we believe that assistive technology matters for health management: it certainly can promote independence and self advocacy skills. It can improve safety and adherence. It can reduce the caregiver burden. It can support routines and consistency. And it can improve the health outcomes and quality of life for our individuals. When we're looking at using assistive technology, it's really important to make sure that we're matching the assistive technology to the person and not the other way around. So we're not going to find one piece of technology that we really like and make it fit for everyone. We're going to look at our individuals and their unique characteristics that make them who they are, and then find the correct assistive technology. So some of the considerations that we want to take into account are cognitive and physical abilities, any sensory needs, their level of comfort with technology, and the environment and routines where the technology would be used. So we always want to emphasize person-centered planning and selection of assistive technology. So we of course have some barriers and then some potential solutions. So cost can be a barrier to using assistive technology. So we can look at different funding sources and we can also consider low tech options. Technology overload can be a barrier, meaning we've got too much going on. So we can simplify and scaffold and build routines. So, for example, maybe an individual has Alexa and or another smart speaker, and at first they're using it just for an alarm clock or just to check the weather, and then eventually they're building it out and doing whole routines or home automation with it. Another barrier can be training needs. So we want to incorporate repetition and supports, and we want to teach and model the use of assistive technology. So we want to ensure that the whole team is on board with using the tech and is aware of how to use the technology. There can also be some privacy and data concerns, but there's lots of ways to mitigate that, including education and putting some safeguards in place. So some key areas of health management supported by assistive technology certainly includes medication management, as I listed before, scheduling appointments, monitoring symptoms and vitals, personal care and wellness, and communication with healthcare providers. So we're really going to dive into the medication management piece. So the way that I broke this up, I looked at the current medication assessment that we utilize with individuals served by county boards, and I looked at the task, and then I looked at some potential assistive technology solutions that could be used to help the person be more independent with that task if they're struggling with it. So the first task is that a person needs to be able to recognize medication by color, size, shape, or by reading the label. So they might have the label memorized, or they can ask for help, or will confirm with someone else. And they also need to be able to know what the medication is for. So there's actually some apps available for this medication identification app. So one that I'll show you on the next screen is the My Med Schedule. There's labels and alternative formats, so we can work with pharmacies to get large print or high contrast labels, labels with photos, or even incorporate a QR code so the individual could scan a code and have a video reminding them what the pill looks like, what it's called, what it's for, and when they're supposed to take it. You could use reading or audio pens like the ScanMarker and PenFriend, which I'll show you on the next slide. And we could also incorporate the use of remote support staffing. So remote support staffing is when staff is available virtually through a two-way communication device like an iPad rather than in person. So here along the top left there, it looks like a pill, some pills and kind of a clock face. That is the icon currently for that app. And then here are some screenshots from the app as well. So you can see that it shows the time of day that you're supposed to take your medication, what it looks like, when you might need a refill. So you can store lots of great information there. The bottom left there, I'm showing an alternative label that has the larger print and a higher contrast, which may be easier for some folks to read. And then the middle and right pictures on the bottom there show the ScanMarker and the PenFriend. Those are both alternative reading devices. So the ScanMarker, you scan across printed text and it reads it aloud to you. So you could use that on a medication label. And the PenFriend actually comes with those yellow stickers that you record a message, and each sticker would hold a different message. So you could one time record what the pill bottle is, and then just by simply tapping the end of the pen to that sticker, it would read the information to you. The next task that we look at on the medication assessment is recognizing when you're not feeling well and knows how to tell and will tell. So some potential solutions for this would be using something like a visual chart or visual support, such as body charts or pain scales, using communication boards to help ease communication. Even if the person has verbal communication, it might be difficult to engage in verbal communication if they're not feeling well. Using communication devices, it could just be a single button or as complex as a complete AAC system. Using one-touch calling tools or pairing assistive technology with interoception teaching. Interoception is our awareness of how our body's feeling on the inside. So my stomach is growling. What does that mean? It might mean that I'm hungry, and my action would be that I'm going to go have a snack. So here's some pictures of some of those items. So on the left-hand side there, we have the smiley face to frowny face pain scale. Just below that, we have a body chart. So you're experiencing pain. Okay, what part of your body is it in? The top middle row there indicates the call to use system. That is a lanyard that can be worn or it could be hung off the side of the bed. And when an individual presses that button, it's going to send a signal to that other receiver that's plugged in another room. So for example, maybe the individual has the button to call and the receiver is in the room where the sleeping staff or sleeping natural supports are so that they can notify them that they need assistance. The top right there, that yellow button could be recorded with a single message. I need help, my head hurts, whatever the individual would need to be able to communicate. And then at the bottom there, we have a larger chart. That's something similar to what we would see built into a communication device to be able to indicate pain in the body and where it's located. The next task would be knows when a refill is needed, so medication never runs out. We'll get the refill, knows who to tell to get the refill when it's needed, or will seek assistance if needed for refill or if medication is not available. So some potential solutions here are using calendar reminders, a good old-fashioned paper calendar, or a voice assistant such as your Google or Alexa. Text reminders from the pharmacy. I know personally, my pharmacy, I have it set up that I get a text reminder when it's time to go pick up my refill. There's automatic delivery systems built into some pharmacies, so the medication will just arrive. A script or video model for how to request a refill. So maybe I know that I need to call for a refill, but I'm just not sure what to say. So you could have a script and practice making those phone calls. And then a reminder from remote support staffing could be another form of using assistive technology for assistance. So here's some example pictures here. On the top left there, we've got a smart speaker like a Google or Alexa with reminders popping up saying it's time for medication. Top middle row there, a text message on your phone. Don't forget, it's time for your medications. The vehicle indicating the pharmacy delivery. Bottom row there, a script for how to call for a medication refills. And then an example of a photo of what a two-way call would look like using remote supports as that reminder. The next task is knowing who to tell or when there's a problem with the medication or not taking the incorrect medication, and will notify that person immediately if there's any problems. So you could have visuals of who to tell, step-by-step decision cards, and again, that medication identification app can be really helpful here as well. So even just a little flow chart of my meds are wrong, I'm going to call, who is that person? Simply posting those numbers in a commonly used place, like on the refrigerator, and then that med management app that we talked about earlier. The next task is knows when to take medication and has demonstrated ability to initiate at the right time every day by using a clock or routine. I think this is one that a lot of folks struggle with. So using things like routine-based cue cards. So first my breakfast and then my medicine. Having alarms and reminders, whether that's on a phone or a smart device like a Google or Alexa or a watch. Lots of different options for alarms and reminders. There's time release pill boxes and pill caps, and there's remote support reminder calls, again, could be utilized to help with medication management. So here we see a couple things. The top left there with the watch with the black band is called the Watchminder. That watch is pretty low tech. It doesn't have access to the internet or texting or anything like that, but you can program reminders in that alert on your watch. The next thing over is just a sliding checklist. So did I take my medicine? Yes or no? Slide it over for the check mark. Again, using a smart speaker. This is your reminder to take your pills. On the top right there, we see examples of a pill cap, and you can do a countdown of when the last time you took it or do an alarm on those. Those are nice, especially if someone's taking something like a pain relieving pill, and maybe I'm taking it at noon and then I can't take it again until 6 p.m. or 8 p.m. I can set the timer on that pill cap so I know when the next time to take it is. Along the bottom there are a couple different pill dispenser boxes, the Live Fine, the MedQ, and the MedReady. All of those have the capability to alarm, and some of them have notifications that can be sent via app as well, in the example of the Live Fine, which is the one on the far left. The ability to get medication to and from storage, out of the container, and to the mouth without spills is the next task. So looking at utilizing things like non-slip mats, easy opening packaging, pill organizers, scoop cards or funnels, automatic pill dispensers, and completing the task simply over a tray or plate with high color contrast can be helpful. So here's some examples of that. On the top left there, we have a non-slip mat called Dysum. We can put that to keep plates, cups, pill dispensers, anything you can imagine from sliding around on a countertop. Along the top there, we've got the tear pouches and bubble pouches and a funnel to help fill medication or store medication alternatively. We've got different types of pill boxes that make it easier to retrieve. And then I'm going to skip the dose there for a second. The next one over is the a little tray to help pour your pills into a device. The Dose Flip is a very kind of high-tech assistive technology. We see that utilized by quite a few folks successfully in Wood County. What's unique to the Dose Flip is that it kind of does all of the things that we just talked about. So when an individual needs quite a bit of support, this can be a good solution. The sensor there has a computer built into it where you set alarms and reminders of the times that the medication will dispense. And then the device will not open until those times. So the lid rotates to the correct slot for the individual to get their medication out. And then it's called the Dose Flip because the way you get your meds out is by flipping the device. There's even a special adapted flipper there that you can see the device sitting on, and it pours into a cup. It's a little bit difficult to see in this photo, but behind the device there, you see that there's a modified filling tray. So I feel like Dose has really kind of thought of all the things. And then this device can also send text, email, or phone call reminders to individuals to take their medicine or if they miss their medication. And you can also have those reminders set up to send to a caregiver. So some other considerations that we think about, does the individual have PRN or as needed medications? So sometimes we need to look at modifying how things are set up or dispensed based on if they have some PRNs. Do they have any liquid, topical, or injection medications? A lot of the solutions I talked about were specific to pill form medications. So there's some other considerations to take with that. If an individual has a large quantity or the size of their medication can indicate what kind of pill dispenser you would need. So, obviously, if the compartment is small and they've got a lot of pills that are quite large, they're going to need something a little different. Thinking about who will fill the pill caddy. So the individual can do this themselves potentially, or they could have a nurse or a pharmacy fill it. Does the pill caddy need to be portable? So am I taking medication at home and out in the community? Do I need to be able to take it with me? Does the pill caddy need to lock for safety concerns? Remember that if you're locking up a pill caddy, you may need to take this to your Human Rights Committee as well. And does the pill caddy need to send caregiver or team notifications to indicate the level of compliance that's happening? So those are just a few of the things that we consider when we are looking at finding the right fit assistive technology for an individual. You can also look at assistive technology for appointments and health reminders. So using some of that same technology like digital planners, visual schedules, smart assistants, text and email appointment reminders, and transportation and navigation supports like the ViaQuest program that we have here in Wood County. There's also assistive technology for health monitoring. So there's smart blood pressure monitors, glucose monitors, scales and fitness trackers. All of those things can sync to an app. That way you have all of your health information in one place, ready to share with your providers. Some of the apps will also track symptoms, pain, mood, fatigue, menstruation, things like that. There's also a lot of assistive technology for seizure detection and fall detection, including wearables, mats that go on beds, and other items. For communication and care coordination tools, we look at using patient portals, secure messaging with providers. So a lot of times there's things like MyChart that can be utilized, using telehealth platforms like StationMD, or shared caregiver apps and dashboards so that your whole team is aware of what's going on, and health information organizers. So sometimes that looks like using the My Health app on Apple devices or other similar apps. So there's lots of ways that we can support folks with their health needs using assistive technology. As always, if you have questions about this, you can reach out to the occupational therapy team at the Wood County Board using this remote support at woodcountydd.org email. Thank you so much.